Great. Good afternoon, everyone. For the second series of the Track A presentations today, my name is John Eaton from Care Connect Plus, and honored to introduce Crossing the Digital Divide in Government Programs. And we have with us Sara Ratner, the Senior Vice President for Government Markets and Strategic Initiatives from Icario, as well as John Gorman, the Chairman from Nightingale Partners. Thank you.
Thanks, John. Sara?
Well, I think you took care of our introduction, so.
That's great. So welcome, everyone. If you want to go to the first slide there, Sara, that'd be great. I'm John Gorman. I'm the founder and the chairman at Nightingale Partners in Washington, D.C. Actually, here, let me use that. That's better, isn't it? We are a fund that invests in, designs, stands up, and operates large-scale interventions in social determinants of health in partnership with payers and providers. If you go to the next slide there, Sara. These are all of our capabilities and the folks that we work with. And the next slide, if you would. Two sides of our house is analytics and advisory on the social side, and then the capital side is the fund where we make our investments. Go ahead, Sara. Thanks.
So we're Icario. Our mission is to make the world a healthier place, one person at a time. So Icario is a health action company that seeks to deeply understand people in order to move them to take action for better health. Our platform, Icario Connect, unites pioneering technology, data science, and behavioral insights, connect everyone to better health. Our mission is to make the world a healthier place, one person at a time. So our personalized health platform, we're primarily focused in the government program space, where we really help health plans understand the best way to reach members. So critical to this is connecting them with the right health care, and it's really a member-focused approach. There are three components to how we approach personalized health action. So it's Know Me, which is really understanding the member. We use data append to first start to understand the member, which is the data enrichment component. So take, for example, Maria. We like to use examples because it helps to contextualize some of what we do. So Maria lives in rural Florida. She speaks English as a second language. She loves to play games. She's got grandkids. She works part-time in a convenience store. So we expose this level of knowledge across an entire population. Then you have Meet Me. So engagement is all about building trust. The best way to reach a member is personal and specific. So it could be email, text, IVR, but it's very specific to that individual. And we know Maria personally, so we know how to connect with her. We know what it takes to get her to engage, to get her to move. And through this platform, we are continuously learning and collecting AI to continue to adjust the approach and get Maria to continue to take health action to better her health. And then Move Me. So by knowing your members, you can connect with them in a very powerful way.
When we're here to talk about the digital divide, it's a spectrum of challenges that face patients in the health system today that were really made very clear during the pandemic, where we really figured out that that internet access really is the new super social determinant of health, and that folks that did not have regular or reliable internet access or the ability to use it, one, were not able to sign up for vaccines for COVID because they had to sign up through these Byzantine local government processes online. But then also that, those with chronic conditions really have no hope of continuity of care without internet access. Once they leave the doctor's office, they basically vanish until they show up again. And that's really a serious problem when we're in the middle of a pandemic. So when we talk about the digital divide, we're not just talking about folks who lack internet access at all. It's also about talking about those who are confined to just use of a landline. Which devices do they have, and does that enable them to use the full spectrum of services over the internet? So are they on just a flip phone, or do they have a smartphone with the additional capabilities that offers? Are they able to access Wi-Fi, which is, obviously a critical issue for kids too during the pandemic, as so much education was being done online, and that's a particular challenge for Medicaid plans in particular. And, are they available to get full speed broadband access when we know that as many as 163 million Americans do not have it? That's almost half the country lacks full broadband internet access. So it's a whole spectrum of issues there, and not the least of which, because so many of us work with seniors, is also digital literacy and, do they actually have the tech support that they need to actually use the internet once it's made available to them? Go ahead, Sara.
So this really has manifested throughout the last year. And what exists is not just a divide between the urban and rural, but it's actually within cities themselves. So really the way I think about it is this is a form of digital redlining. So this is derived from the notion of the practices in the 1930s, which further segregation efforts at the time when insurers refused to issue mortgages to those that lived in African American neighborhoods. And now the practice of internet service providers investing in less broadband infrastructure in these areas in low income and marginalized neighborhoods, it's just a modern day form of redlining. And an example that I like to give is with Cleveland. So recently AT&T did a major upgrade in their broadband infrastructure. But Cleveland is a city with a huge wealth divide. And so where did they upgrade? They upgraded in the really, really wealthy neighborhoods. And so this led to really significant speed differences in the lower income and marginalized neighborhoods. So the marginalized neighborhoods were getting about 3 megabytes per second in download speeds. The wealthier neighborhoods were getting 18 megabytes per second all the way up to 1 gigabyte. So that really shows the difference. And then one of the reasons for this that we've seen today is net neutrality. And this was, in 2017, net neutrality was abolished. And this allowed broadband companies to decide really where to build their infrastructure and how much to charge. And the reversal of the 2015 decision by the Obama administration to do this really eliminated the strong oversight of internet service providers. So when you think about what's happening from a policy perspective, experts have said that the current digital divide should really serve as a catalyst for ubiquitous internet, really in the same way that the Great Depression highlighted the need for ubiquitous electricity.
Thanks, Sara. When you look at where Americans lack broadband access, this map is a little deceiving because it looks mostly like a rural problem, but disadvantaged urban communities, thanks to the former guy's policy around net neutrality, have the same access issues that often affect a lot more people than you see in these rural communities. Go ahead, Sara. And as I mentioned earlier, Microsoft estimates about 163 million Americans without internet access, and you see some very distinct lines in who has the ability to get onto the internet. Households that are earning less than $20,000 a year have a broadband adoption rate of only 62%. Those earning up to $74,000 a year have an adoption rate of 83%. And those over $75,000 a year have an adoption rate of 85%. So this is clearly a rich and poor issue, and has dramatic implications for health, especially in the tail end of this pandemic. Go ahead, sir.
So people on Medicaid and Medicare make up 2/3 of those without access on the internet. 36 million people in the U.S. are in a double burden county. And what that means is there's very low broadband rates and very high mortality rates. But the cost of broadband coverage is really more cost effective for plans to offer broadband coverage than to reach out to people, whether it's by mail, by phone. If you add up the numbers of what it costs to dial somebody or send a piece of mail compared to the $11 a month that an individual could pay for a hotspot, it pays for itself very, very quickly. And this need is reinforced by the fact that only half of all adults that are earning less than $30,000 have broadband access. And the same amount have a cell phone, but no landline. So really, this is the population that is the most price sensitive, where additional infrastructure costs cannot be absorbed into their monthly income. So engaging in a cost-effective way is absolutely critical. So this ultimately rolls up to the conclusion that access remains an issue for a huge population.
When we look at the populations that are really lacking broadband access, you see it particularly in education, as I mentioned earlier. This is a huge issue for Medicaid plans in particular. But when you look at, say, the rates of Hispanic or Black students or those just earning under $30,000 a year, you just see the huge proportion of kids that have to do their homework on a cell phone, which you can imagine how difficult that is. Those that are unable to complete their homework because of a lack of a reliable computer or internet connection. Look at, again, this is an economic issue here in particular when you look at those earning less than $30,000 a year, or those that have to use public Wi-Fi to do their homework because they don't have a home internet connection. Go ahead, Sara. And it's a particular concern, again, for Medicaid plans when you look at the rates of early childhood education and the proportion of kids that actually need internet access to complete their homework.
So broadband access varies really quite widely by category, but the charts above reflect that statistically, income is the largest indicator for broadband access, with the upper left chart reflecting a 29.2% difference in coverage. Interesting enough, Medicaid coverage and disability status are less of an indicator, and you'll note that there's only a 7% difference between those with and without Medicaid coverage and broadband access. And also MSA is less of an indicator, which I thought that may be different than the stats show.
Yep. And again, going back to the maps, we see a really high correlation between lack of internet access and the prevalence of chronic conditions, especially obesity and diabetes in particular. Go ahead, Sara, if you would. Here you see rates of obesity over 1/3 of the population and how it correlates to lack of internet access. Next, Sara, you've got those that are reporting poor or fair health. Again, very high correlation there. And then again, just generally over serious chronic conditions, especially diabetes. We see that this is an epidemic of folks that have no access to this kind of information or the ability to monitor and manage their conditions without internet access. So we wanted to talk with you guys next, Sara, if you would, about some of the compliance considerations that are involved in health plans like yours offering a broadband or internet access benefit. And this is, I think, a particular note to plans in Medicare Advantage and in the exchange as well, because we know that we've all had a COVID dividend, if you will, from the lack of utilization that occurred during last year's and this year's lockdowns. We saw, especially in outpatient services, utilization was way, way down as folks stayed home. And as a result, a lot of insurers really racked up a nice surplus in cash reserves as a result. They weren't paying claims at nearly the rate. And so now is really the time to be thinking about whether or not you're going to run into minimum medical loss ratio issues in third and fourth quarter. And so offering an internet benefit really can fall into a couple of different buckets. One is, this certainly fits within the special supplemental benefits for the chronically ill in Medicare Advantage or SSBCI. This is basically, anything that's health related, and for those with chronic conditions. These types of benefits are counted under your minimum medical loss ratio, and they are included in the bid. But you can also offer an internet benefit, and this is often how we do our interventions at Nightingale, as an off-benefit administrative service, so that you can target it to the folks who need it the most. Remember, if it's in SSBCI, you have to offer it to everybody who's eligible, but as an administrative benefit, you can just target it to the folks in greatest need. As investors, that's kind of how we like to spend our money, is to just make sure it's going to the folks that really need it, not to, Leisure Suit Larry who's out there playing golf 4 times a week. But then you can also offer it as a reward or an incentive for wellness and preventive care, and this is generally targeted to those in greatest need as well. Go ahead, Sara, if you would. And there's lots of different ways to finance a broadband internet benefit. If it's on benefit, you can pay for it out of your own treasury, or you can bring in some external third-party capital like ours. We're going to talk in just a second in more detail about the option of a mid-year benefit enhancement, which I think is going to make sense for a lot of plans that are up against minimum medical loss ratio concerns for this year. You can offer a snap on-the-spot mid-year benefit enhancement with just a simple notification to the CMS regional office. There's no, submission to the central office or revising your bids at all. It's just a simple notification to the RO. You can do it off benefit, as I mentioned, and this is an administrative benefit you can pay for either yourself or with external financing or under SSBCI. If you're going to bring in external capital to do this, and this is of particular interest to Medicare Advantage plans, which typically compete on a zero premium product. So every dollar that you would invest out of your own treasury into an internet benefit is going to, basically be charged against your zero premium, and would make you potentially less competitive. So there's lots of funding that's coming from the federal government, as we'll talk about in just a second. The FCC has started up a huge new program thanks to Biden's relief package for the pandemic, and there's billions of dollars in internet access funding in Biden's infrastructure package if he can get it past Republican resistance in the Senate. There are a number of particularly progressive states that fund their own internet access programs at the state level, and then there's private funding like ours, or through large internet service providers and foundations that have an interest in these types of services. Go ahead, Sara. So, as I mentioned, you can offer a mid-year benefit enhancement that could include an internet or broadband benefit. As we mentioned, there's going to be lots of plans that run up against minimum MLR concerns this year, and we'll have to dispose of some cash in order to stay above that threshold. And again, this is one where you can just offer it with a simple notification to the regional office and just do it on the spot. So it's certainly something we want to encourage a lot of plans to consider, whether or not you're running up against that minimum medical loss ratio. Sara?
So some solutions today. There's a number of different things that are happening at the local level, and those are supporting device access, hotspots, and Wi-Fi range expansion. You'll see on the right there's a list of all the different programs that are offered by the different ISPs, and it's somewhat of a dichotomy with the fact that they're constricting their ISP investments, but they're also offering these additional programs. But irrespective of that, it still is really a highly fragmented and structured way to drive a cohesive access and adoption of this. So people also need to be made aware of the fact that they do have reduced or low-cost coverage. One of the stats that I learned through studying this is that 70% of the people who have access to low-cost or free broadband access actually don't even know about it. So there's a real need in helping people and working with people, especially low-income community members, to make them aware of and to connect them to the low-cost or free broadband service. And we've been speaking a lot with Internet Essentials, which is Comcast's division that offers subsidized internet. And what they reported, and it was as recently as Friday night, we were talking to the head of their SDOH program. I mean, who would have thought Comcast would have an SDOH program ultimately? But we were talking to them, and what they said is that healthcare is absolutely the best way to find and target individuals who need access and to adopt broadband. And it's really one of the most economical, because we know that with the telehealth expansion, driving people to telehealth is going to improve their health, it's going to decrease the cost, and it's going to keep them engaged in a system that has marginalized them. So some companies are offering these. Some health plans are starting to offer low-cost or free programs, hotspots. But the most comprehensive program that John touched on, and we'll speak about in a second, is the emergency broadband benefit that was developed by the Biden administration.
Thanks, Sara. Great case study here is Nemours Health System found at the outset of the pandemic that it was unable to reach many of its patients through a telehealth program because they just simply lacked adequate internet access or the devices to use it. And by standing up a big broadband benefit and really rolling out Wi-Fi hotspots across their service area, they saw a dramatic 2,400% increase in utilization of telehealth benefits and the ability to really do remote monitoring for their chronically ill patients, especially their chronically ill peds patients, by offering this as a service. They then conducted training with over 700 clinicians to provide more appointment availability. They saw just a dramatic increase in show rates for those appointments and much improved continuity of care for those who were chronically ill through remote monitoring and through telehealth, not just through the provision of internet access, but also by giving devices out to those who needed them to be able to use that internet access to fullest capability. It's one thing when you guys hear about all of these member engagement companies that, for instance, compete with Icario. There's a very big difference in telehealth for those that have a smartphone versus those that only have a flip phone and can only use text messaging. And there's a very big divide there, and the effectiveness of those communications between the two. And so Nemours found that by providing a tablet or by providing a smartphone to those that needed it, that those telehealth visits were far more effective and had better results as a result. Go ahead, Sara. Now, this is our general framework for how we stand up a broadband service benefit with our clients. We have found in this last year of our investment track record that broadband is now one of the common threads in every investment that we're doing, alongside, say, food security and the deployment of community health workers. It's absolutely essential for the types of investments that we make to counter the effects of poverty in these underserved communities. And so the structure that we typically get into is that as an opportunity zone fund, we have to set up a NewCo in one of the roughly 9,000 opportunity zones around the country, and in one of those opportunity zones where our client operates. We will then set that company up, and they call it everything from a social management services organization to an innovation center or a center for social health excellence, whatever you want to call it. It's the investment vehicle through which our capital flows, and that which we then engage downstream the broadband service providers, downstream vendors, and community-based organizations to then provide those services. We will then have a data exchange and a value-based arrangement with our client, usually the health plan or the big health system, and we will engage in some shared savings or shared revenue with them, and that's how we repay our investors at the end of our investment history. So that's just one framework by which you can do this. And as Sara will tell you in just a moment, there are lots of ISPs out there that are engaging in these types of investments and activities to try to make broadband service more equitable, especially for those that are chronically ill and underserved. So Sara, would you tell them a little bit about what came out of the pandemic relief package?
Yeah, so the emergency broadband benefit, or it's referred to as EBB, it's administered through actually the FCC, and it gives eligible households a $50 a month subsidy that can be used to pay for broadband benefit, and they also get a $100 subsidy towards a device.
When you lay it in on top of the existing program they had, it's actually about $60 a month.
Yeah,
that's a big deal.
Huge. And so now this money is actually administered through the ISPs so that they're encouraged to offer free or reduced cost, well, actually free internet to those who need it. One of the interesting components of this, though, and I'm curious to see how it actually flushes out in a way that becomes or encourages adoption, is that all individuals have to complete an eligibility form with the federal national identifier. And then, but Medicaid beneficiaries are a category of those that are eligible, but they still have to go through this verification process. And then once the eligibility form is completed and confirmed, and we know that individual is qualified, they have to fill out an ISP application to enroll in the specific benefit. So this is a multi-step process, and one of the things that we're working through is how do we make that easy? How do we connect people to this benefit so it does not become so difficult that actually the wonderful substance of what this is trying to do becomes lost and deal with some of the bureaucracy that this creates. So this will continue to, I think, mature and evolve, and we'll see an easier member, consumer, citizen process that comes from this.
Yeah. It's important to note that you automatically apply or qualify for the EBB if you're enrolled in Medicaid or if you're enrolled in SNAP or the food stamps program. If you lost substantial income during the pandemic, this is really a wonderful program that will be expanded dramatically if Biden can get his infrastructure package through the Senate. Now, this is not to say that doing any of this is necessarily easy. Standing up a broadband benefit has its own implementation challenges. And I know there's a lot of plans out there that are saying, you know, this sounds more like a utility. Why should we as a health insurer have to engage in this kind of stuff? And, you know, for the reasons we cited earlier, that if you want to have any hope of continuity of care for those who are chronically ill, if you want people to have access to information to help better manage their own conditions, if you want people to sign up for vaccines, as you know, we know they have to get through these Byzantine local government processes in order to do it, they've got to have internet access to be able to do it. Now, for us, the challenges are around analytics. As investors, we don't want to just go carpet bombing internet access across an entire geography. We want to target it to the folks who need it the most. So that means you got to do a lot of upfront analytics to figure out where the need is, and specifically right down to the household level. Geography is really important around broadband access because generally you don't want to undertake this for a single family or a single member, but where you have clusters of members is really where it makes a lot more sense. You know, remembering that this is a benefit that costs on average about $11 to $15 per member per month to offer, but you know, you see multiples of that in terms of the return in terms of reduced healthcare costs. So it's well worth offering, but geography matters. Defining the problem is an interesting challenge because you got to ascertain, is it just lack of access to the internet or to broadband? Do they have the right devices? Do they lack just digital literacy? Do they just not know how to use these devices or the ability to access some of these programs? The benefit design is very important. The who, what, and the where, and the when. Is this going to be an on-bid benefit that will be made available to all? Is this going to be an administrative benefit that can be targeted just to those who need it the most? Then you got to really think about deployment. Again, Geography really matters here. Analytics really matter to ascertain where you're going to set up these routers, these towers, these Wi-Fi hotspots, et cetera. The member tech support is tougher than you would think, especially if you're serving seniors. Those of you who have grandparents, or you have kids who are helping your parents with tech issues, you know what can go into helping with digital literacy and the ability to use the devices and the access that's been given them. So actually having member tech support that's going to be more robust than you think it would need to be is critically important to them actually using this benefit once you give it to them. The member experience is really important here, and that really tracks to member tech support. That member experience, and that's directly measured in the Net Promoter Score among those members who've been given this benefit, is critically important. You can give this to them all they want, but if they don't have the actual tech support to be able to use it, then it just becomes frustrating to them, and it can actually become a drag on your CAHPS and STAR scores if it's not done with an appropriate level of support. And then the clinical integration for those chronically ill members to make sure that this is an integral part of your care management programs, and that your telehealth capabilities is really intimately coordinated with what's going on in your care management teams, is really critical to this a benefit like this being effective and really helping to drive those STAR scores that we all know matter so much. Sarah? I think that's it.
Yeah.
We've got just enough time for some questions and answers.
One thing I'll just offer in while we're coming up to get the questions is Icario put out a booklet about social determinants of health, and you can go pick one up in our booth, but it really talks about the barriers and how do you deal with the barriers. So go out there and check it out, and love to meet you. Go ahead.
John, did we get any questions?
We did, so we'll jump right to the chat room. We do have several that came in. First one's from Shannon, and she asked, with the increasing free Wi-Fi hotspot services, what are the EMF considerations, and what are ways to minimize EMF while still supplying internet to all?
You want to take that one?
Go ahead.
She said EMF?
Yeah, EMF.
I'm not.
So maybe, Sarah, if you could comment in the chat, just maybe some more context around that. We might come back to that one.
Yeah.
But Michael also asked, will 2G cell technology continue to be a factor for all patients? Or will that eventually be replaced completely as broadband access expands to all areas?
Well, I think they're two separate issues. I mean, first you've got the cell technology, and then you've got separately the broadband access. I think the cell technology is probably less of an issue right now if people have broadband access. So we're seeing actually minimums of gig speed go up, requirements around that. I think when we first did this a while ago, it was 25. Now it's 50 as a requirement. But focusing on the broadband speed is critical.
Yep, absolutely.
Great. Any questions from the audience while we're also bringing into the chat room? We do have another from Elizabeth that asked, another acronym, I apologize. How would you, or could you use the CAPGI funding model for broadband? And if so, who would you identify as the brokers? CAPG?
CAPGI.
Wow, this is like a acronym soup, and stump the.
It was the model that Len Nichols discussed this morning, where they're putting together investors and collective communities to fund, create, develop, and advance attention to social determinants, but all at the community level. And they wrote a grant, and it is taking off like wildfire. And I apologize.
So, I'm going to attempt to do it as eloquently, but essentially looking at, there was a paper written that focused on a new opportunity just around SDOH programs and funding models. And my takeaway from the presentation this morning was looking at leveraging someone who's a trusted broker in the community that's able to look at who are the stakeholders? What are you willing to pay to support this initiative? And how do we do that in an equitable and fair way? And so looking at that model to really spearhead innovation and funding into SDOH initiatives.
I'm not familiar with
So one of the companies that we've spoken with does this, and they do it in the California market, and they're a nonprofit. They offer reduced cost internet to whole populations, but they're struggling right now. They're kind of a broker and a trusted source where they've got access to, CenturyLink, Cox, Comcast, and they refer people out to these different resources. But what they've said is the hardest thing is how do you service these members? Because you've got the digital literacy, you've got the questions, you even have cultural sensitivities that you need to be aware of. And so that's something that we're talking to them around, well, how do we work together to figure this out? Because some of these aggregators will be critical in helping to solve this problem and deal with some of the fragmentation.
And if you could, Brandy just asked for a clarification again, the PDF version of the booklet that you produced, if that's available, where would they grab that?
They can grab it off the internet. It's called 6 Social Determinants of Health Insights to Break Down Barriers. They can access at our virtual booth as well.
Exactly, as well as the presentation. We did have some clarification from Shannon, thank you, on the EMF. And so it's the increasing Wi-Fi hotspots. Are there considerations for EMF, which would be the electromagnetic field? So a lot of concerns with increased technology and reaching dangerous levels of EMF through our health. Is there any considerations for that? Is that a part of the dialogue in this field?
Not where you're dealing with communities that lack broadband or internet access at all. I don't think you have to worry about too many signals in part of the communities.
Sure.
Most of the communities we're doing this in.
Yeah, and the health considerations around obesity and health, I think, far outweigh any EMF concerns that the communities have at this point.
Great. Thank you for that. Any questions from the room as we're wrapping up? And really just want to join me in thanking our speakers. It was an amazing presentation. I'm sure we'll be hanging around for some different dialogue after this, and we'll be meeting back in this room at 2 o'clock for our closing presentation. So thank you.